That kind.
Hi, my name's Amber. I'm going to be the NP student assessing you today. How are you doing?
Good.
Good. What's your name?
Nathan.
Nathan, nice to meet you. What brings you in?
Physical for work.
Okay, what kind of a job do you do?
Work for an excavating company.
Okay, and how many hours a week?
40 to 50.
What shift?
First.
Wonderful. Are you a man or a female?
Male.
And how do you identify?
Male.
Okay. Well, how old are you?
29.
Do you have any cultural preferences that I need to be aware about?
No.
Okay. Just gonna kind of ask you some questions. Have you ever had a history of surgery?
No.
Any history of hospitalizations?
No.
Any kind of trauma history?
No.
Any kind of recurrent illness or occupational illness in the past?
No.
Have you ever been diagnosed with a chronic medical condition such as cancer?
No.
Hypertension or heart disease?
No.
Asthma?
No.
Alcoholism?
No.
Diabetes?
No.
What about your family? This pertains to your mother, your father, any siblings, grandparents on your mother or father's side. Have any of them been diagnosed with cancer?
My grandmother on my dad's side had breast cancer.
And she's still alive?
Yes.
Okay.
My grandfather has type 2 diabetes on my dad's side, and then my grandfather on my mom's side died of liver failure.
Oh, I'm sorry about that. What about your social history? Are you single or married?
Single.
Okay. What's your living arrangement like?
I live with my girlfriend and 3 kids.
Okay. Do you have any kind of stressors that?
Just the normal everyday stressors.
Okay. Any kind of coping mechanisms that you use to help deal with those stressors?
I mean, I smoke cigarettes. I guess that would be a coping mechanism.
Mm-hmm. And you said that you have a job?
Yes.
Oh, great. And then, do you have a good support system?
Yes.
Wonderful. What about your psych history? Have you had a history of, or are you currently being treated for a medical illness, a mental illness?
No.
Wonderful. Have you had a history of, or are you currently having any kind of suicidal ideations?
No.
Wonderful. What about substance abuse? Have you had a history, or were you treated for in the past, or currently being treated for any type of substance abuse, such as THC, opioids, cocaine, stimulants?
No.
Wonderful. Have you ever tested positive for Hep C?
No.
Awesome. What about your psych history, your reproductive history? Have you had any kind of urinary hesitancy?
No.
Any type of erectile dysfunction?
No.
How many sex partners have you had?
4.
4. Are you sexually active now?
Yes.
Are you using protection?
No.
Do you have any children?
3.
3. Okay. And you said your sexual preference would be female?
Yes.
Okay. Wonderful. Now, allergies. Do you have any seasonal allergies?
No.
Medication allergies?
No.
Environment, food allergies?
No.
All right. What about medications? Are you currently taking any prescription medications?
No.
Over-the-counter medications?
No.
Herb or supplement medications?
No.
Awesome. What about tobacco use? Do you smoke, vape, chew?
Smoke.
What do you smoke?
Cigarettes.
How many? How often?
Half a pack a day.
For how many years?
10 years.
Oh my goodness. Have you considered on quitting?
Not seriously.
Okay. What about alcohol? Do you drink?
2 a day. 2 beers a day.
2 beers a day? Okay. What about your immunizations? Are all your vaccines up to date?
Yes.
Do you have a current flu shot?
No.
Do you want a flu shot?
No.
Okay. What about your diet habits? What do you consume daily?
A lot of processed foods.
Okay, about 7 days a week?
Oh, yeah.
How's your caffeine consumption?
Nah, not very high. 2 or 3 cups of coffee.
A day?
Week.
Oh, a week. Okay, good. Do you exercise at all?
Nah, not. I don't go to the gym or run, but between work and the kids, I stay pretty active.
Mhm. What about sleep? Do you get enough sleep at night? How many hours would you say?
4 to 6 hours.
You feel well rested?
Most mornings.
That's good. All right. Next, I'm just going to ask some questions about your overall body systems. So, generally, have you felt fatigued at all? Had any kind of fluctuation in weight changes, such as weight gain, weight loss?
No.
Any type of dizziness, headaches?
No.
Blurry vision, eye drainage?
No.
Ringing in the ears, ear pain?
No.
Any kind of nasal congestion or drainage?
No.
Any type of sore throat, bleeding gums?
No.
Any masses or lumps in the neck?
No.
Have you experienced any shortness of breath or difficulty breathing?
No.
Have you experienced any chest pain or palpitations?
No.
Good. What about diarrhea, constipation?
No.
Any urinary frequency or painful urination?
No.
Have you had any kind of numbness or tingling in your lower extremities or difficulty with walking?
No.
Have you experienced any edema in your legs or cramps in your legs?
No.
Any kind of intolerance to hot or cold or excessive sweating?
No.
Any type of abnormal bleeding or bruising?
No.
Any type of anxiety or depression that you've experienced?
No.
Okay. That's good. Next, we'll just go ahead and grab your vitals, and I'm going to wash my hands, and we can perform the physical assessment. All right. Overall, your general survey, you look upright, you're dressed appropriately, you look pleasant. Can I have you take your shirt off? Wonderful, thank you. The first thing I'm going to do is just kind of inspect your skin, check to see if there's any redness, discoloration, any type of lesions or moles. Wonderful. Next, I'm going to go ahead and touch your head if that's all right.
Yes.
Your head is normal cephalic, symmetrical. I don't feel any depressions or lumps. Next, I'm going to go ahead and shine a light in your eyes. All right, pupils are 3 millimeter. They constrict to about a 2. They're round, reacted to light. I'm going to have you follow my pen or my finger. Wonderful. I don't see any nystagmus, or lid lag. Next, if I had an ophthalmoscope, I would place it to my left eye, go to his left eye, brace his head. I would go ahead and come in at a 15-degree angle, look into his eye for a red reflex. Once I find it, I'd go in closer. I would assess the retina, look for his artery and veins, check for any kind of hemorrhaging, exudate, have him look into the light. I would assess the macula and fovea. After that, I'd have you open your mouth. All right, good. I'm just checking the posterior pharynx, looking at the hard and soft palate, which is pink. No injection. Looking at, can you say ah? Stick your tongue out. All right, perfect. Looks like the uvula is midline and rises, as well as his tongue is midline. No masses seen. Next, I will shine a light on his frontal sinuses, as well as his maxillary sinuses. Then I would go ahead and palpate any pain or tenderness.
Nope.
Wonderful. Next, I'm going to go ahead and kind of feel his temporal artery. Okay, nice and strong. Gonna just kind of grab here on the TMJ, have you open and close. Wonderful. TMJ range of motion is smooth, no redness, any tenderness.
No.
no tenderness, no clicking felt. Next, I'm going to go ahead and inspect and palpate his ears. Just looking at the auricle, feeling it, no masses, no tenderness, feeling the tragus, and palpating on the mastoid. Any tenderness?
No.
Wonderful. Next, I'm going to go ahead and if I had a otoscope, I would go ahead and brace, lift up on the auricle right here and brace, place into the ear, look at the ear canal. I don't see any sermon, no redness, no edema. I would look at the tympanic membrane. I would assess for the cone of light, look at the malleus, assess for any type of perforations. After that, I would go ahead and assess his carotids. All right. Okay, nice and strong. I'm going to go ahead and feel for his lymph nodes, preauricular auricle, posterior auricle, tonsillar, submandibular, submental, occipital, come down to the superficial, cervical, down to the deep cervical, posterior cervical, and then can I have you kind of push up and then feel the supraclavicular. Lymph nodes are less than a centimeter. They're mobile and soft. Did you experience any like kind of tenderness when I was touching or palpating there?
No.
All right, good. No tenderness. Next, I'm going to kind of look at your thyroid. Can I have you look up? All right, good. Go ahead and swallow. Going to feel for the thyroid cartilage. Go down to the cricoid cartilage. Feel the isthmus come around. Going to displace the trachea. Feel for the thyroid lobe. Displace to the other side. Feel for the right lobe. Thyroid is soft, symmetrical. No lumps or masses, no goiter observed. Next, I'm going to assess his cervical range of motion. Go ahead and look up towards the ceiling, down towards the floor. Look to your left, look towards your right, and then go ahead, ear to the shoulder. Ear to shoulder. Good. I think that's it for that. Oh, next I'm going to listen to your lungs. I'm going to listen posteriorly. Take a deep breath. Deep breath. Deep breath. Deep breath. Okay. All right. All posterior lung fields clear. I'm going to go ahead and listen to his right middle lung, which is going to be right below the horizontal fissure. Go ahead and take a deep breath. Good, nice and clear. Next, I'm going to assess his heart valves. So I'm going to start with my diaphragm. I'm going to go to the right of his sternal border, second intercostal space, and listen to the aortic valve. Then make my way to the second intercostal space on the left side of the border, which is pulmonic. Down to the third intercostal space, which would be Erb's point. Down to the fourth to fifth left sternal border would be the tricuspid. And then midclavicular fifth intercostal space would be the mitral valve and also the PMI. From there I flip over to the bell, mitral valve, tricuspid, herbs, pulmonic, aortic. Wonderful. If I suspected a murmur, I would have the patient lean forward, have him exhale, or I could have him lay on his left lateral decubitus side. Next, I'll assess his JVD. So if I could have you kick up your legs here and just place your head right there. Wonderful. What I would do is I would have him at like a 30-degree angle. I'm going to have you look towards me. I'm going to shine a light on your neck over here. Go ahead and look the other way. Same thing. I'm checking for the internal jugular pulsation. Once I were to find that, if I wanted to measure the JVD, I would take a ruler, place it on his sternal angle, take another flat edge. I would hold that up to where I see the pulsation of the internal jugular, and then I would measure it from there. I'd have him sit up. The higher that he sits up, the less obvious it is to see the internal jugular pulsation. All right, thank you. Next, I'll have you lay down. I'm going to assess your abdomen. Just looking at it, looks like his abdomen contour is flat. It's symmetrical. I don't see any massive scars or peristalsis. Next, I'm going to take a listen to his bowels. All 4 quadrants are active. Next, I'm going to take a listen to his aortic arteries. I'm listening to his renal, iliac, and then I'm going to take a listen to his femoral. All right. I'll also take a listen over his liver, as well as his spleen. Perfect. Next, I would percuss. I'm going to percuss all 9 areas. Listening for tympany. If you hear dullness, you're over an organ such as the liver. In order to percuss the liver, I'd go right underneath the right nipple line, work my way down in between the intercostals, and then find the liver border. Then from the umbilical, I would work my way up and percuss to find the liver border. Next, I'll palpate his liver. I'm going to take my left hand, place it under his left and 12th rib, kind of push up. Next, I'll take my right hand and work my way up towards his ribs to find the liver border. Have you take a deep breath, and then just kind of feel it there. All right. Next, I'll assess for the aortic pulsation. Just kind of come up above the umbilical, push down in between, a little bit left midline, find the border, and just kind of push. Make sure that it's no greater than 3 centimeters, because that would be an abnormal finding. Okay, then I would palpate with light and then deep. Any tenderness?
No.
No tenderness upon light and deep palpation. Next, go ahead and swing your legs over. I'm going to check for some CVA tenderness. Just going to come right around back here. You're going to feel me pound a little bit right on your lower back. Any tenderness?
No.
Tenderness?
No.
Good. All right. From there, I'm just going to check your radial pulses. All right, a nice 2 to 3 plus. I'm going to check your posterior tibia, about a 2 to 3, and then dorsal pedis is a +3. I'd look at the legs, note symmetry, which both of his legs are symmetrical. There's no edema, no redness, hair distribution is normal, legs are warm, feet are slightly cool, but cap refill is less than 3. No ulcers observed. I'm going to look at your hands, same thing, check the color, cap refill less than 3, no clubbing, no lesions, warm, hair distribution normal. Next, can I have you come on and stand up? All right, I'm going to have you put your feet together. Wonderful. I'm just kind of stand up for about 20 seconds, assess him with his eyes open. Then I'll have you close your eyes, assess him for 30 seconds to see if there's any kind of a sway, which there's none. That would mean a negative Romberg test, so no sensory ataxia. All right, wonderful. May I have you walk forward? I was just assessing the gait. Turn back toes, heel to toes. Great, perfect. Then I'm going to look at your anterior superior iliac spine. Note the iliac crest. Go around the tubercle. Down to the anterior superior iliac crest, then come down, feel the greater trochanter. Next, have you turn around. Same thing, only this time we're feeling for the posterior superior iliac, which is usually right under the dimples, right there. Perfect. I will have you go ahead and touch your toes. Good. Now bring it back up and lean back as far as you can. Perfect. Next, I'll have you go ahead and turn towards your left. All right. And then next, I'll have you turn towards your right. Okay. Then just kind of lean at your waist towards your left side. Same thing with your right. Good. Go ahead and step forward and look towards me. Go ahead and turn around. I'm going to have you raise your hands up above your head. Wonderful. Have you bring them all the way back behind you. Okay. Back to your side. I'll have you bring your hands up above your head on the side. Back down. I'll have you bring one arm up and across over towards. Wonderful. Other arm. Good. All right. Then I'll have you bring your up arm back over and touch your shoulder blade. Same thing with the other arm. Okay, good. Let's just check in the flexion, extension, internal rotation, abduction, adduction of your shoulders. Next, I will have you have a seat, I think. All right. I'm going to assess your arms. Can you put them up towards me? Just your upper body strength. Go ahead and resist. I'm going to pull towards you. Towards me. Good. I'm going to push towards you. Wonderful. Go ahead and put your wrist out. I'm going to push down your wrist. I'm going to pull up. Okay. Next, I'm going to have you grab my 2 fingers. Try to pull. All right. Next, I'll have you stick your hands out like this. I'm going to grab your fingers and try to push them together. Wonderful. Next, I'm going to have you try to put your thumb and pinky together while I try to pull them apart. Good, nice and strong. What else? Okay. Next, I think I'm going to just have you lay on your back again. I'm going to test your hip range of motion. I'm going to have you bring your knee to your chest, other leg. Ooh, okay, good. I'm going to kind of help here. What I'm going to do is hold it at a 90 degree. I'm going to go ahead and bring your leg in, assessing for external and internal rotation. Okay, good. And do that to the both sides. Next, I'm going to take your leg and bring it towards your midline, assessing for adduction. Bring it out towards me, abduction. We would do the same thing with that leg. I'll have you lay prone, so that means just go ahead and lay on your belly. From there, I'm going to bend your leg, and you're going to feel me pull up on your knee. And this is just going to bend at your hip, and I'm just assessing your extension. All right, good. And I would do that to the other side. So range of motion smooth. Did you have any kind of tenderness?
No.
Good. Next, I would just assess his suprapatellar regions for any kind of tenderness or pain. Feel his epicondyles, medial and laterally. Feel for the bony ridges. I don't feel any abnormal boniness or masses on both legs. I would feel for the 4 ligaments of the knee, his medial collateral ligament, posterior clavicle ligament, ACL, and then the LCL on both sides. Any tenderness? No?
No.
Okay. And just keep feeling. Next, I'd come towards his feet. I would assess his Achilles tendon. Any tenderness?
No.
Okay, good. I would feel his metatarsal phalangean joints, metatarsals in between the grooves of both feet. Okay. Just kind of feel for any kind of bogginess, any pain or tenderness.
No.
All right. And then I think that's it, really. Okay.
Thank you.
Yep, you're welcome.